So good morning, good afternoon, good evening, wherever you're joining us from the world. My name is Beatrice Yomiti. I work with Population Services International as a global monitoring advisor for the A360 project, and I'm based in Nairobi. I will be your moderator for today. I just want to welcome and to thank everyone who has made it to join us in this webinar on the approaches and strategies to support adolescent and youth contraceptive continuation in sub-Saharan Africa. We are very glad that you're able to join us as we have these conversations on how we can support young people in their contraceptive journeys. So before I start, I'd like to acknowledge the conveners of this webinar. We have the A360 Continuation Technical Working Group. We have FP 2030 and the Tiko team. So thank you so much for organizing this. As we continue, I'd request all of you to do your introductions on the chat. Please mention your name, your organization, and where you're joining us from. Feel free to put your flag there. And also you could add your LinkedIn profile and other socials links on the chat if you'd like us to follow you. So welcome. So we have a great lineup of speakers and a valuable discussion ahead. I'd like to encourage you to stay tuned, make use of the chat to engage as we move along. I'll go ahead and introduce the speakers for today. So we have Felicity Nioma. Felicity works with FP 2030 as a youth focal point for Nigeria. We have Leah Ogada Wanaswa. Leah works for Tiko. She's the Kenya Country Director at Tiko Africa. And then we have Happy Manasseh. As you can see, she looks very happy. Healthy works for Society for Family Health. She's based in Nigeria. Happy is zealous and likes working and focusing on really removing barriers that prevent young people and adolescents from accessing contraceptives. And we have Winnie Musubika. Winnie works with Population Services International as a senior technical advisor for adolescent and youth sexual reproductive health. Thank you. So just encouraging you to make use of the chat as we go along to just post any questions that you might have. Our team will be monitoring the chat and responding to the questions as we move along. And without much ado, I'd like to welcome Felicity Nioma to take us through the first presentation. Welcome, Felicity.
Hello, everyone. Greetings. My name is Felicity Norma Ike. I work with FP 2030 as the Nigeria Youth Focal Point, and I'm really excited to be here to be speaking on the adolescent contraceptive discontinuation in Nigeria. So over the course of this presentation, you'll get to know why adolescents discontinue, what are the reasons, and what are the challenges, and also what can be done. Please, next slide. Yes, so we'll be looking at, the introduction, what are the reasons why, adolescents discontinue. We'll get to know, about it, and also about the organization I work with when it comes to improving the youth programs. And also we'll be looking at the core reasons, the objectives about adolescent discontinuation. And also we'll be looking at, when it comes to data, what is the data telling us? What is the FP 2030 annual data, telling us about the discontinuation of contraceptives by adolescents? Then we'll also be looking real into the reasons. What are the couple of reasons, why adolescents discontinue? And then what are the consequences? What are the implications? And then I'll also be sharing some recommendations or some solutions to that. Next slide, thank you. Yes, so like I said earlier, that I work with FP 2030, and this particular organization is the only global partnership that is centered solely on family planning. So we work around family planning. We ensure that we improve family planning programming across countries. And also, next slide, please. Yes, so in FP 2030, we focus more on the youth. We improve their reproductive health, ensuring that young people across countries make informed decisions about their reproductive health, and looking at different strategies. How can we improve these services for young people through data-driven strategies, prioritizing policies, ensuring that we design effective programs, and all of these are aimed to improve uh, reproductive health for young persons, and also champion youth leadership. We aim at significantly reducing unintended pregnancies for adolescents, for young people, and also enhancing their overall health and well-being, and which is the core reasons why we are having this webinar today. Is because of adolescents, because of young people want to ensure that we meet their needs and also address the concerns, the various challenges that adolescents face every day. And also we'll be looking at, next slide please, and also we'll be at FP 2030 recently, part of our commitment to improving adolescent and youth programming, we launched the AY strategy, which is the adolescent and youth strategy pillars, earlier in the year. And these strategic action pillars that FP 2030 developed is focused around 5 pillars, which look at, first of all, showcasing high impact service delivery models for adolescents. We also look at prioritizing AY in country commitments, because across countries we have some countries that have made commitment to FP 2030, and these are all geared towards improving adolescent and youth services. We also look at data driven policies, decision making, because without data we cannot be able to improve policies, improve the various programs that we do across our country, in our different regions, in our different communities. We also look at championing youth leadership, because we believe that young persons have the right, young persons can make decisions for themselves, young persons have the leadership, and they can also lead, design programs, be able to co-create programs across board. Then finally we look at building allies, because most times we believe that young persons might not always be at the table. Therefore we need allies coming from different stakeholders, different parastatals, to also ensure that we create decision making spaces for young persons. These are all the key pillars that FP 2030 focus on, to ensure that we improve adolescent and youth programming. Next slide. Yes, so now into why we are here. So like I said earlier before, that we'll be looking at adolescent discontinuation of contraceptives in Nigeria. And family planning is empowers individuals, it empowers adolescents to be able to make informed decisions, to be able to control their future, to be able to plan their family families. And but however, over at adolescent, because of a number of reasons, a number of factors, and deep dive into this presentation, you will get to learn the reasons why adolescents discontinue. And also we'll be looking at the challenges. What are these different challenges? What are the impacts? What are their implications? And then we're also going to be looking at what can be done, how can we resolve, how can we address this discontinuation, and will importance, which looks at having accessible healthcare, supportive policies, effective programs, and what have you, to ensure that young persons continue contraceptive use, because family planning is very important in the lives of adolescents and young people across board. Next slide. Yes, so we'll be exploring the reasons, like I said before, why adolescents discontinue contraceptives, and also be highlighting the implications. And then I'll be providing, some recommendations, some strategies, to ensure that we address these challenges that young persons face every day. Next slide. Thank you. Yes, like I said before, that one of the key pillars of FP 2030 is to ensure data-driven policy, data-driven information. And what FP 2030 does every year is to ensure that we have annual data reports, and looking at discontinuation rates for young people, especially in Nigeria. FP 2030 report states that, you know, young persons discontinue these contraceptives based on two things. So we'll be looking at the reasons that young persons discontinue this contraceptive because of, you know, based on their reasons, their personal reasons, and also looking at the method, but not on the disaggregation of data. This is because how FE 2030, you know, provides this data, or how they calculate this data, does not also include or does not allow, you know, it based on the age range of these young persons. So our main focus is on the reasons and also on the method. And over time, we've had, based on the reasons, we've discovered that, you know, young persons discontinue these contraceptives, you know, because they want to, you know, start a family. Maybe they want to get married and then, you know, start having children. They discontinue these contraceptives. And then also, another reason, you know, why adolescents, from the report, states that it could be because, you know, separation from their partner. You know, sometimes their husbands, their partners could, you know, travel, and therefore they can decide, you know, not to continue with the particular method that they are used to. And then there's been a report from the PROB. They did an analysis, you know, on why young persons discontinue this data. And part of the report states that injectables, you know, have the highest overall discontinuation rates. And over 65% of women under 25, you know, start this method and discontinue it by the end of 12 months of use. So here we are looking at, you know, 1 year of the discontinuation, and this is where the data, you know, is based on. And also part of the reasons why, you know, young persons, adolescents discontinue this data, or why injectables, you know, have the highest overall discontinuation, is because of the side effects. Their reasons could be side effects, and also because they want to, you know, get pregnant or start a family. Next slide, please. And then looking at, you know, the another, you know, method that have the highest 12-month discontinuation rate are the pills. So most adolescents, most young persons discontinue this also because of the side effects, also because of the because they want to, you know, start having children, or, you know, get pregnant. And we'll be looking well into these, you know, reasons in the coming slides in the course of my presentation. And also, interestingly, data also, you know, have reported that young persons or adolescents discontinue this contraceptive based on some reasons are positive, which, as you can see, because they want to become pregnant, which is a positive reason, and also because of they want to reduce the need, you know, of using this contraceptive based on their personal needs, and also because of based on their personal wants. And next slide, please. Yes, so now, like I said earlier, that we'll be looking at the various factors, various reasons why adolescents discontinue contraceptives. So based on the individual level, we have side effects, like I've mentioned here. That side effects could be the reason, you know, looking at weight gain, you know, menstrual changes and all. And I'll be giving an example. I remember when I worked as an adolescent officer in the southern part of Nigeria, in Calabar to be precise. So I was supporting the family planning unit at General Hospital in Calabar. So those years, I think that was 2020 to 2022 thereabout. So I really had, you know, practical experience, you know, of how, you know, young persons look at assessing family planning. And also because of my presence in that family planning unit, so we really had, you know, increase of young persons coming to that facility. And on a particular day, you know, there was this young person that came to assess family planning. So she came, okay, she already had, I think, injectable before, I think some months before, but she came back asking us to remove that for her. And we asked her what's the reason. Actually, she's married. She's a young married young person. So she said that her husband asked her to remove it because of from the workplace, or so people were telling him that this could make the wife not to, you know, not to be fertile, you know, it could, you know, increase her body size, you know, blah blah, you know, all of those, you know, myths and and the misconceptions that people have. So when she came, we had to counsel her properly and explore, tell her what the methods are about, how the different methods, how she could also decide on what she wants, and also enlighten her, empower her with the key information that she needed, tell her that contraceptive use is very good, and not to listen to what people tell her and all of that. And after that, she had to invite her husband. Her husband also came, so we had to provide counseling to the both to the couples. And after then, we had to ensure that she let's do a follow-up so that she could continue with the contraceptive method. And then most after, she came back for another method. So these are like part of the misinformation that people have about family planning. And also another reason why some young persons or adolescents are also based on infertility. I think this is very key, because personally I've had a lot of young persons come to say, I will not use family planning because I won't be able to take in there are just so many things. And most times when you sit down to start counseling them, and you need to be patient with them so that they could understand that all of these are misinformation, all of these are not true, right? So these are also part of the reasons. And then looking at the social cultural factors, we see that pressure from family, from partners, like this, that the experience of some partners discouraging their wives not to access this family planning, or to go and remove it and all of that. So there are also stigma, because we've seen that over the years, young persons, like people stigmatize young persons from accessing family planning because of this and that and that and that. So there's just a whole lot of factors that affect young persons assessing or continuing with family planning. Next slide, please. Then like I said, that there are consequences, there are implications to discontinuing family planning. Because we know that family planning empowers young people, empowers adolescents. And when there's a discontinuity in using contraceptives, there are also implications. And part of the implications, we'll be looking at the health aspect, which includes increased risk of unintended pregnancies. Like in this picture, you can see that this adolescent, this teenager is pregnant, and also these are like the risks associated with it. Then we will also see high rates in unsafe abortions. Most times, when young persons cannot access this, or when they discontinue this particular method, it could also lead them to having unsafe abortions. When there is unintended pregnancies, they can decide to abort it. And then we also see that there are implications in terms of the maternal and child health of that particular young persons. When you take in or be pregnant without being planned or having plans for it, and at that particular age, it also has its own implications at birth and all. Then let's also look at the social cultural factors. Impact on education and economic opportunities. As an adolescent, as a young person, when you discontinue this and maybe you get pregnant that you didn't even plan for, it could also have an impact on your education, on your schooling, and other opportunities in the society that you want to go for. And then there's also a risk of increased poverty and dependency, because we've seen scenarios, especially as Africans, where poverty is one of the key challenges that we are facing every day, especially in Nigeria, where we have inflation here and there, hiking everything. You can't even eat 3 square meals a day and all of that. And then you now maybe taking or have an unintended pregnancy that you didn't even plan for. The risk of even of not having money to take care of yourselves and all of that. You see the burden of that. So that is the challenge, and this is why family planning is very key. It really helps in the economy. It helps to ensure that we plan for the future. And then we see the long-term implications when it comes to community and national development. Like a country like Nigeria that is overpopulated, and family planning is very key, because when you don't have food to feed that millions of people, it results to poverty, it results to even death and a whole lot of it, which means that family planning has a key role to play when it comes to when it comes to ensuring that we improve Then it shows ensuring that we improve the national development. Next slide, please. Second rush. Next slide. I think I'm almost done. Yes. So what are the recommendations? So there is need to advocate for comprehensive sexual education, implementing policies, effective flow policies, and also ensuring there is supply and availability of contraceptives. All of these key recommendations are very important. You having youth-friendly services, training healthcare providers, and also ensuring that we involve males and addressing gender norms. When all of this is done, I am sure that we can improve, services. We can also encourage young persons to continue contraceptive use across our country, especially in Nigeria. Thank you very much. Thank you for listening.
Thank you, Felicity, for that great presentation, for helping us to really get insights as to why adolescents discontinue FP and the implications of that. I think they are broader, and I think you've been able to capture that very well. So my question is, how can we address these challenges and the concerns that the young people have so that we're able to support them to continue better? So that's a reflection question. So I think I will call upon our next presenter, and that is Leah. Welcome, Leah.
Thank you, Beatrice. Good morning, good afternoon. I will be taking you through the Tiko contraceptive continuation strategies in the Tiko platform for adolescents 15 to 19 years. Next slide. So Tiko is a sub-Saharan Africa-based non-profit organization that uses digital motivation platforms to increase access to health services in 6 countries in the region. When users digitally engage with Tiko's technology platform, they are able to access a variety of subsidized services, including sexual and reproductive health and HIV services. This empowers the adolescents and young people to make an informed decision about their healthcare by removing the barriers to access to these services, providing them with what they need to make an informed decision, and by tracking the decisions they make to tell us what methods or services they're using and how often they're coming back for repeat services accessed. Through our digital platform, Tiko, and our local ecosystem of partners, we connect Tiko members to existing local service providers to meet their health and wellness needs. Next slide. So a bit about the Tiko platform. The Tiko platform connects partners across supply and demand to give members who are the adolescents and young people access to quality sexual and reproductive health products and services. The platform is free to users as we generate impact, using donor funding to pay and reward the full ecosystem, who are the clients, mobilizers, retailers, and service providers. Engaging in health enabling behaviors enables members to receive rewards, economic return for health gains. Mobilizers are paid for the impact they generate and service providers for the services they provide, while funders pay for the platform maintenance and development costs, investing in the impact generated by the platform. Next slide. So just going to the aspect around contraceptive continuation, we have defined continuation as the percentage of adolescent girls or young people 15 to 24 years who have taken a contraceptive method in the past 12 months and have returned within 2 months of their method expiry to either refill the same method or switch to a different method. And these methods are either short-acting or long-acting methods. Next slide. So we have been able to merge platform data and feedback from users from the platform ratings they provide after they access the services, and also from the client exit interviews to enable us understand the factors that actually drive contraceptive discontinuation. From the user's perspective, the top 3 contributing factors were inadequate information during the counseling process on side effect management that leads to discontinuation when the side effects present themselves. Infrequent sex was another issue, and this includes those users who are in boarding schools or whose boyfriends live in other towns, and therefore with sporadic use of short-acting methods periodically prior to intercourse, and therefore perceived low risk of pregnancy. Time and efficiency also matters to them too, and they will discontinue if they experience delays with the service at the facility. Provider counseling gaps were also identified, which include inadequate counseling from the service providers regarding management of side effects for short-acting methods, including how to use methods, what to do in case they need a change in method, date to come back for refill, that they could change to another method is information they need, and what to do if they experience side effects. Provider bias was also identified, particularly towards short-acting methods for adolescent girls, despite the girls stating preference for long-acting method. Gaps in mobilizer support were actually identified also, and this is gaps particularly in providing follow-up support for contraceptive continuation. Next slide. So in terms of the current interventions that Tiko is implementing to improve continuation of the users include sharing information on side effect management, and particularly for the risk of sporadic use of contraceptives to prevent unintended pregnancy. And this we do through providing information education materials. We also send SMSs to girls who have phones to share the same information and also to remind them for their subsequent date of return for their refill. For the health providers, we are conducting trainings on the importance of counseling for continuation through client-centered counseling, which should include side effect management information that should be provided to the users. While for the mobilizers, we have included training on follow-up and also support utilizing the data that we have on our platform to ensure they are actually able to reach the girls and enable them to remind them to come back on time for their refill. Next slide. So we utilize various nudge strategies that enable us to target critical knowledge gaps and support needed from our users, as well as continuing to equip the mobilizers and service providers. We began our focus in counties with the lowest continuation rates as we worked through the rest of the counties. And we base this on the data that we are able to receive on our real-time dashboards that enable us to identify users who are yet to come back for their refills and who are yet to come back on time. And we are able to then identify through the same dashboards which nudge strategy is actually working and which one is inefficient based on the ability of these girls to be able to come back on time. Next slide. Thank you, and available for questions on the same. Over to you, Beatrice.
Thank you, Leah, for that session. I think quite informative. Thanks for sharing how you're using technology to really support the girls to continue on methods. Interesting themes coming up. There are reasons why girls and young people discontinue contraception. Issue of side effects, sexual frequency. Some of them don't perceive themselves to be sexually active, while some are probably in school. So what methods would work well for them? Issues around a method preference and provider bias. How do we address this as we implement adolescent contraceptive programs? So thank you very much. I will call upon our next presenter, and that is Winnie. Willie, karibu.
Thank you, Beatrice, and thank you everyone for joining us. Unfortunately, my video is having challenges, but I'll continue without it. So I'll be speaking to the importance of contraceptive continuation, and I'll also provide a snapshot of A360's continuation strategy. As a way of introduction, A360 is a project implemented by Population Services International and co-designed with young people to advance adolescent sexual and reproductive health interventions across 3 countries. A360 positions contraceptive as a tool that can help girls and couples to pursue their self-defined aspirations by expanding girls' contraceptive method choices and strengthening health systems to be more responsive to the unique needs of the adolescent. Next slide, please. So A360 defines continuation as the sustained use of modern contraception for 12 months, inclusive of method switching, while still in need of contraception. So we realize that sometimes young people actually have a reason to stop contraceptive use maybe because they want to get pregnant. But in this case, we are saying that a young person who still needs contraception should be able to sustain its use for a period of 12 months, including switching a method where need be. Why contraceptive continuation for adolescents? Of course, there are many reasons, but mainly I'll speak to 4 that have been alluded to by the previous presenters as well. So I'll be really brief and run over this. First is prevention of unplanned pregnancies. We're all aware that adolescents are at a higher risk of unintended pregnancies due to various factors, including lower use of contraceptives and inconsistent use of the contraceptives. So using contraceptive methods and encouraging continuation can significantly reduce that risk. We also encourage contraceptive continuation for adolescents because we want to promote their educational and career opportunities. Teen pregnancies can disrupt education and career plans, and therefore avoiding unwanted pregnancies, adolescents are more likely to complete their education and to pursue their career. And then, of course, the economic impact that unwanted pregnancies can have on the community and the broader economy. If adolescents do not complete their education or even achieve a stable employment, there's a long-term loss in their economic productivity, which in the long run actually impacts on the broader economy of our societies. And then, of course, their health and well-being, reducing morbidity and mortality. Unintended pregnancies can have substantial physical, emotional, and socioeconomic impacts on our adolescents. So preventing the pregnancies and using contraceptives really help to avoid these potential complications and help adolescents maintain better health and well-being. Next slide, please. Some of the reasons for contraceptive discontinuation that I want to speak to today. Sorry about that typo, should have been discontinuation. So there are many reasons that I've categorized into 4: contraceptive method failure, side effects, provider and quality related factors, and also community related factors. Contraceptive method failure in this case can be defined as a person becoming pregnant while using contraception due to failure of the method or incorrect and inconsistent use of that method. In most cases, young people are actually prone to inconsistent and incorrect use of methods compared to the older women because of so many reasons. One, compared to older women, unmarried adolescents or young people are more likely to discontinue due to irregular sexual activity. This has been well explained by the previous presenter. And then, of course, the fact that most cases, young people are most likely to be offered and to use short-acting user-controlled methods like pills, injectables, or condoms. And these methods are associated with higher discontinuation rates than the long-acting methods, which would require removal by a health professional like the IUDs and the implants. So that makes it easy for them to actually discontinue the methods. The other reason, common reason that has come out from both presentations as well is the inconsistent use due to stock out of commodities from the facilities where they're supposed to access these commodities. So usually when they are out of stock, they're not able to continue, causing inconsistencies and discontinuation of the method. The other effect, the other reason for discontinuation are the side effects, mainly the menstrual bleeding changes or the weight gain. And there's also a general fear of infertility or birth defects or while using contraceptives. And these side effects really affect all age groups. But for adolescents, it is more pronounced because they may not be cognitively prepared to deal with the side effects, and they usually have a higher sensitivity to experiencing these side effects than the older women. And then when it comes to the fears of infertility, it's across all age groups, but you will understand that for young people, because some have not yet started childbearing or have actually not completed their childbearing plan, their fears are more heightened compared to older women who might have already achieved their, childbearing goal, or have actually had a few children and can easily, bear the thought of infertility. Yeah, and then one other reason why there is inconsistent use among the adolescents also is that and where we have challenges in terms of supporting them address the side effects that come with contraceptive use, is that most of the adolescents prefer to access the contraceptives from private and informal sources, such as the pharmacies and drug shops, for the obvious reason that these probably are more convenient for them, or provide privacy and confidentiality that they're really very much interested in getting. So when they access services in these informal sources, we have challenges in that these structures are not able to support them access the high quality counseling that they need to support sustained use of the contraceptives. Provider and quality related factors. These have also been alluded to by the previous presenter, but I'll just speak about a few statistics in there. So across age groups, poor quality of care contributes to high rates of contraceptive discontinuation. We have an estimated 40 to 60% of the overall discontinuation rate reflecting decisions based on the quality of care. And evidence indicates that 27% of women actually stop using contraception within a year for reasons related to low quality of care. We know that youth face significant barriers in accessing quality family planning care, which hinders both their initiation but also continuation of contraceptive use. Some of the barriers may be stigmatization from a facility staff, when seeking a contraceptive, or even just seeking information on family planning. There are concerns around confidentiality, service hours as well, waiting time, and provider bias. We know that provider bias usually leads to adolescents using a method that is not their preference or is inappropriate to their circumstances and needs, which eventually would result to discontinuation because this young person in the first place did not want that method, but because of the provider bias, this method was forced onto them. Limited service hours may mean that the adolescents don't have a convenient time to return to the facility for resupply, so they might end up discontinuing. Inconsistently actually using the method. And then of course, we've had evidence showing that waiting time, lack of privacy and cleanliness might mean that youth may not be motivated enough to return to the facility if they experience any of those. And then community related factors here, we're looking at husband or spousal disapproval and social norms. For many married youth, they may discontinue a method because they want to become pregnant immediately or early in their marriage. And usually this is related to societal pressure, either from their spouses or other influencers in their homes, like their mothers or their mothers-in-law. So all these social norms and community-related factors as well lead to adolescents not continuing with the methods. Next slide, please. So at A360, what is our strategy in addressing some of the challenges that I have mentioned? We have developed a strategy that targets reducing method failure, managing side effects, supporting sustainable access, and strengthening the enabling environment. We have called these what we call our buckets. We have put our approaches in buckets, in those 4 buckets. Under the first bucket, which is reducing the method failure, we have a number of activities or approaches in there, and these approaches may differ across the context, across the different countries that we work with. One of the approaches under reducing method failure is active client follow-up using client follow-up appointment cards, which works hand in hand with strengthening family planning, client records management. So the follow-up appointment card really supports the young person to be able to remember the date when they're supposed to return for a refill of any method, especially the short-term methods. But then the client record that remains at the facility is organized in a way that if a young person misses a visit, the facility or the provider is able to catch that immediately and follow up in the community to ensure that this young person actually shows up. And then we have provision of youth-friendly services. This really is to address issues related to waiting time, confidentiality and privacy, and provider biases. We have also piloted some approaches around follow-up calls and SMS reminders, but realized that these the effectiveness of these really has variations across urban and rural areas, and also depend a lot on the digital connectivity of the young person. For those young people that are fully connected, this has proved to work because they are able to receive the SMS reminders on time and the follow-up calls for them to return. However, we have a number of young people in the regions where we are implementing who do not really have access to phones and are using maybe for their husbands or their mothers. And usually we realize that this method does not work well for them because they may not receive the messages on time, but also it breaches the confidentiality that we want to maintain for the young people as we provide the services. The second bucket, where we're looking at managing side effects, we mainly are concentrating on providing quality counseling services for the young people. And in this case, we're using the counseling for choice approach to support counseling. This approach proactively addresses anticipated side effects that support continuation. So compared to traditional counseling methods, C4C reduces the information overload, which usually leaves clients feeling overwhelmed and in most cases not able to compare methods based on how they affect their daily lives. C4C instead considers the client's needs, focuses on the client's retention of what to do, what to expect, and when to come back for the particular method that she has chosen. And then they're also prompted to help clients make a plan for remembering how to use the method correctly and what to do if they experience the most common side effect of that method. We have realized from our data that this C4C counseling has been very helpful in supporting to manage side effects among adolescents, and they appreciate the fact that it is really needs-based and it focuses on them as the clients. And then of course method switching, whenever young people are encouraged to return to the facility whenever they experience any common side effects, and we have an opportunity for them to actually switch a method to one that they can easily cope with. So that is also one of the other approaches under managing side effects. Under bucket 3, we do support, we do implement 2 approaches. that is commodity forecasting, management and reporting, and then commodity redistribution. All this is done through the health system strengthening, where we support facilities to forecast, and then to ensure that as they are forecasting, they are actually focusing on data that is coming through and focusing on the needs and requesting for those commodities that are needed by the young people in the facility. And then for commodity redistribution, in all the countries where we are working, we have reproductive health coordinators that support commodity redistribution from low demand facilities to high demand facilities. They keep monitoring the stock levels in the different facilities and move these commodities around to ensure that the facility that needs the commodities most actually has enough to keep them running as they wait for the government to supply commodities. And then finally, our final approach to ensuring continuation is strengthening an enabling environment. This is where we're addressing the social norms, but also the attitudes towards use of contraceptives within our communities. We do have two approaches. We have one approach that deals with the household level key influencers, and these are usually the husbands, the mothers-in-laws, and the mothers of the adolescents. And in this case, we're really just addressing misconceptions around contraceptive use and also speaking to the attitudes regarding use of contraceptives within the household, encouraging the household members to talk about contraceptives and also to normalize the contraceptive talk within the households. And then at community level, we're looking at the key influencers at that level, including religious leaders, cultural leaders, and really trying to sensitize them on contraceptive use and addressing the social norms around that. Also helping them to understand how they can support the adolescents to actually use the contraceptives. So in a nutshell, these are the 4 buckets that we use in our strategy to address contraceptive discontinuation among the adolescents. We believe that there's no one single magic bullet that actually supports continuation for adolescents, but it has to be a combination of so many, approaches to address this, because the adolescents are not homogeneous. Like we know, they are diverse, they face different, challenges, and therefore we have to address each of them to be able to push for continuation among adolescents. Thank you so much. Over to you, Beatrice.
Thank you very much, Winnie, for giving us a deep dive into the drivers of discontinuation and the optimal package and strategy that A360 is using to support contraceptive continuation while the adolescents are still in need. I think you've really taken some time to really put that, to package that well. And I think one of the things that we're seeing is that it is important to have a clear strategy and clear strategies on how we address the challenges and the issues that are faced by the young people. And I think what you've shared is a good example that we could borrow from. So thank you very much. I know we've been following some presentations for a while, so I'm going to invite Happy to take us through some interactive section. So stay tuned. Happy, you're welcome. Take charge.
Hello, everyone. Good afternoon once again. I want to believe that we've had a very interesting time so far. And so, for this next round of the webinar, we'll be responding to some questions using the Mentimeter app. So, for us to join, this is the link displayed on the screen. So we quickly pick our phones, go to our browser, enter mentimeter.com so that we can begin to answer to the poll questions. Can anyone hear me?
We can hear you well, Happy.
Oh, okay. For a minute, I thought I was speaking to myself alone. So please, let's copy the address on the screen and then quickly rush down to Mentimeter to respond to the poll questions. We'll be discussing it afterwards here on Zoom. Please, can you still display the screen with the Mentimeter link, the address? Some are yet to.
I have added it to the chat, so the code should be in the chat for everyone.
All right, the responses are coming and we can all see it. So we expect if you are not there, you are wrong. Quickly join so that we can receive your response too. Who did talk? Who did talk? Who did talk? Can we move to the next
Happy,
question, please? So I hope we can all see the screen. How can social and cultural norms around contraceptives be addressed to support continuation among adolescents? We have the responses before us: engaging community leaders, encouraging peer-led discussions, implementing public awareness, promoting positive role models. Which of these approaches do you feel is more effective? Let's receive your response. So we have 9 more seconds before we move to the next question. Feel free to drop your response so that you are not left out. So thank you everyone for participating in this session. So I just want us to look at few questions. Let's look at it together from the responses we gave. So let me read out one of these questions first so that I can shed a little light to it. So what? So from our responses, we said to this question, which approaches are effective to improving contraceptive continuation among adolescents in sub-Saharan Africa? And a lot of responses came in. Like this, we have education close, almost on the same ranking with youth-friendly healthcare services. So I can see from this vote for this question that a lot of us believe that health-friendly healthcare services is very important. And I can't agree less. Looking at a lot of studies that have been conducted so far, this shows that multiple approaches can actually work, not just one. Looking at 21% vote for education and awareness program, 22 for youth-friendly healthcare services. So all these approaches work hand in hand to address continuation issues in sub-Saharan Africa. So I mean, I can't agree less with this particular responses that we have. Maybe can you share another question with me? Another of the response so that we can quickly do that. Very important. How important is it to involve key influencers in discussion about adolescent contraceptive continuation in sub-Saharan Africa? Seeing that the adolescent stage is a very peculiar stage in life, whether adolescent as a married one or a single one, it is very important that we factor the relevance and presence of key influencers in their life. And these key influencers could range from their husbands, their mother-in-laws, down to their mother. How important is it? And we just have one person that said, somewhat important, but collectively, from our votes and the numerous studies that have been conducted, we can see that involving key influencers in making decisions regarding contraceptive continuation is very important. We have even conducted some of those studies in A360, whereby we engage religious leaders, we engage husbands, we engage mothers of adolescents. One of our program in the circle, Nigeria Girls, we even have mothers for facilitating sessions just to show that they are in support. And then with that, we saw a high rate of continuation in the South. Coming down to the North, we also have key influencers engagement where we engage the husbands. The husbands in turn support their wives. So they don't only adopt methods, they come back to continue. And we've seen that that's one of the approaches that works a lot. That's not the only approach we've used. We've also engaged with religious leaders and community gatekeepers. We know that in Africa as a whole, people tend to listen more to their leaders, be it community leaders or the religious leaders. And if we can get to engage with these key influencers so that they understand the nature of programming, they in turn can be able to advocate for these approaches we are bringing so that it can improve continuation. Because from one of the posts I saw, we were looking at stigma and pressure from the community, and it has a linkage to this. Because when we get adolescents to actually adopt methods and then the community begin to frown at it, we see a lot of discontinuation. But once you involve key influencers and they give their support to adolescents, you will discover that continuation will keep being on the increase. And as far as we have adolescents with unmet needs, it is very important that we involve critical stakeholders such as their key influencers in that decision we are taking. So now, which is the best strategy to effectively reduce barriers to contraceptive continuation use among adolescents in sub-Saharan Africa? We are moving digital now. You can see from our responses, 3 approaches stand out: mobile health clinics, community health worker outreach, local peer educator programs. This, among so many other approaches, are the approaches that different programs, different partners, and even the government are applying just to ensure that they improve adolescents' contraceptive continuation. So if we look at this closely, the world is moving digital, and most adolescents are always on their phone. What's the better way to reach them if not through those platforms? The better way to reach them is through their phone, so that once they use their phone, they are opportune to access relevant information that is going to contribute in improving their overall well-being and also support them with the right information to make informed choice and decision. So at the end of this poll, I want to say that we have come collectively to an agreement from our votes. We've come to an agreement that there are areas that we need to align in order to address the problem of continuation. And it is still a question that we need to ask ourselves: how else can we improve this rate? What more can we do to promote continuation of contraceptives by adolescents? So even as we go back after this webinar, it is a call for us to sit and to critically think of more strategies that we can employ just to ensure that continuation is at its highest peak. Thank you so much.
Thank you, Happy, for taking us through that interactive session and engaging us, at least at another level. So we'll move directly into the Q&A session. And if you have any questions, please post them in the chat. We'll have our team responding. I had seen one of the questions on the chat. Leah responded to it, but I'll ask you to just talk through it. So there was a question from Wanjiko asking, what's your sustainability model beyond the project to ensure contraceptive continuity, considering contraceptive use is incentivized? Leah, could you chime in on this one?
So the issue around the issues around the girls' needs, because one of the things we are trying to identify as we intervene in this particular project is what is actually contributing towards the issues of increased teenage pregnancy. And so one of the things we have identified is poverty is a leading factor. And that's why we are actually having a situation where more and more girls are resorting to the issues around unintended pregnancy. And one of the aspects that we are trying to intervene on is to be able to identify what is really their needs. So we have identified that these young people have needs around sanitary towels, which is actually a leading contributing factor because, as I've mentioned, they're vulnerable. And so as we are able to reward, they're able to redeem and actually obtain these sanitary towels for their use. And so our hope is, as we continue to engage with the respective governments, that this is a need that we are, as stakeholders and as different governments, going to intervene so that we are able to mitigate against a need that's really presenting itself. Thank you, Beatrice.
Thank you. I see there is another question for Tiko as well. And this is from Noura Nasir. I'm interested to know who pays service providers and community mobilizers the performance-based incentive. If it's the donors, how sustainable is the initiative?
So based on the profile of girls we are targeting, we are targeting girls who are unable to afford to pay for the services. And so, yes, it's donor funded, fully subsidized. And so, as I've mentioned, we need to be aware of what the issues are that are actually facing these girls and plan for them. And so that's the purpose of this intervention, so that we are aware of what needs are there, so that as we do our budgets in government, we are able to consider this population also included in that budget. Thank you.
Thank you very much, Leah. So I have two other questions for the panelists. One is to Felicity. How can health systems better support adolescents in maintaining consistent contraceptive use, particularly in resource-limited settings? Felicity, respond to that. Then I have one for Winnie. What role do families, peers, and communities play in influencing adolescent contraceptive continuation? And how can these social factors be leveraged to improve the outcomes? This one is for Winnie. So I'll ask Felicity, you could respond first, and then we can have Winnie.
Okay, thank you, Beatrice, for that question. I think from the mentee.com poll that we just did, we've kind of, mentioned most of the approaches that health systems, should use to support adolescents to ensure, there is continuation of contraceptive, especially in resource limited settings. So I'll just highlight some of the other challenges that I think is quite important. So when it comes to improving access to contraceptives, I think that the health system have a big role to play in terms of ensuring, services are tailored to adolescents, because adolescent needs varies. So, and also they should ensure that healthcare providers are trained, so that they won't be judgmental to young persons, because that scares a lot of adolescents and young persons away. Also, when it comes to financial barriers, health systems should ensure that we remove high costs, because most times when young persons can't even eat, how would they be able to access or pay for these contraceptives, especially those that are in the rural areas and those in the resource limited settings as well. So, and also I think another area that can also build on is to ensure that these services are closer to the young people. I like the work that the HECC are doing, that ensuring that community health workers in these rural areas meet the needs of young persons, especially those that requires these services. And also we can also expand more on ensuring education and awareness. Like I said, we've mentioned it in the mentee.com. I'll just highlight the more importance on peer education. We young people, the adolescents, we respond better to our peers. Most times you listen more to what your friend tells you and all of that. So we should ensure there is more peer education to dispel some of these myths and misconceptions around um, um, contraceptive use. And then another area before I close is reducing the stigma and the cultural barriers around accessing contraceptives. Most times there are a lot of barriers to young persons accessing these services, and we should ensure that we engage the community. There's more of community engagement, involving parents, religious leaders, and like the previous speaker mentioned, what they're doing in HEC is ensuring that they engage or involve the religious leaders. I think that is really a good one. And also looking at leveraging technology, just like what the Tiko team are doing, they're ensuring that they're using technology to reach young persons to respond to their needs. I think that's quite important. And then finally, the importance of having variety of contraceptive choices. I think it's very important now, because most times when young persons cannot access a particular contraceptive, it's important that we expose them to the various contraceptive methods so that they can be able to, choose from the wide range of contraceptive options that are available. I think when we're able to, address, all of these barriers comprehensively, I'm sure that we'll be able to improve the overall health outcomes for young persons, and also reduce the unintended pregnancies. And yes, thank you.
Thank you, Felicity, for the comprehensive response. Winnie.
Thank you, Beatrice. I'll just go over the question again just to make sure I picked it right. You
want to
asked
go through
what role what role do family, peers, and communities play in influencing adolescent contraceptive continuation, and how can these social factors be leveraged to improve outcomes, right?
Yes, that's correct.
Okay, thank you. So in response, of course, we all know family, peers, and communities really play a crucial role in influencing continuation, and each one contributes really differently. I'll start with the family influence. So as a family, we know that evidence shows that families that openly discuss sexual health and support contraceptive use can positively influence adolescents' decisions and practices. So parental guidance and support are essential in reducing stigma related to contraceptive use, but also families can help adolescents access contraceptive services by providing maybe financial assistance where it's needed and transportation to the health facility. How do we leverage the family structure to support? We could support by parental education, providing information, accurate information to the parents, and supporting them on how to actually openly discuss contraceptive use with their adolescents. Then they are able to, move this discussion within the family structure. So I think that in that way, we really are leveraging on that structure. In terms of peer influence, usually we know that positive peer support can lead to higher rates of contraceptive use, while negative peer pressure can lead to inconsistent use. So leveraging on this would be having peer education programs that actually discuss contraceptives and train adolescents to provide accurate information, so that as they're influencing other peers, they actually have the accurate information, and they're able to normalize contraceptive use and encourage healthy behaviors within their peer groups. And also use of peer support networks. This has been talked about, where we create support groups where adolescents can discuss their experiences, share advice, and encourage each other regarding contraceptive use. So then that will help them continue use of contraceptives. At the community level, of course, the role and influence of the community is related to the cultural norms and the stigma around contraceptive use. But we know that communities with supportive attitudes can facilitate better access and adherence to the methods. They could actually they can support to expand the resource basket if they have a mobilizing resources for contraceptives within the community, so young people can access that. But they also help reduce stigma. If they promote contraceptive use, then they will reduce stigma and of course development of youth-friendly services in the community. So that, for me, I think is what I would respond to that question, which is thank you.
Thank you, Winnie. I see there are more questions coming up on the chat. And I know that we're running out of time. So if you allow us, we'll just probably respond to one more, and then we will respond to the others and share them as we share the link to this webinar. So I will call upon Teferi. There is a question here from Christopher, and he's asking, we have been engaging government and other critical stakeholders to ensure FP products are included in the basket of health insurance products. This has potential to improve continuation rates. Is there any experience in this area for other countries that you can share? So Teferi, in your context, do you have any experience on this one? Or Leah or Rwanjiko?
Thanks so much, Beatrice. So in our case, contraceptive services are especially in public facilities are free of charge. So wherever, be it in an insurance scheme or not, at any healthcare system across the entire system of the healthcare system, in our case, be it at a higher hospital, district hospital, primary healthcare unit, the contraceptive services are free of charge. So in this case, I don't think that it affects in our case, but the effect will be in private sector, so that the private sectors, whenever clients go to take contraceptive method from the private sector, they have to pay for that and get the service. So unless otherwise, the service at private sector in the government system, and in the service are free of charge. Thank you.
So thank you, Teferi. So Teferi is sharing the experience from Ethiopia. So he's saying the services are totally free, except if you go to the private sector. So we'll also just document all this and provide responses as we share the webinar recording. Thank you all for coming. Next slide, Valerie. Yeah, so thank you so much for joining this webinar that was focused on the approaches and strategies. On the 26th of September, we are going to have the second webinar. So this is a two-part series that's going to be really sharing evidence on the measuring success on AYSRH, and especially contraceptive uptake and continuation. So we will be sharing the links soon. So please plan to join so that you can see all the evidence, all the data that we have collected across this area of contraceptive continuation. I know some of us like the numbers, and that will make you tick. So be on the lookout. We will be sharing out the link. And there was a question on the chat, I think it was from Dr. Keegan of NCPD, about whether we'll share the presentations. Yes, we're going to share the presentation and the webinar recording. Thank you all for joining this call, and we look forward to seeing you on the 26th of September. Have a good evening, have a good day, and a good night, depending on where you are. Thank you, and bye-bye.